And welcome to X-Ray Review. In this video we're going to look at some stranger things on X-ray. So please don't forget to like and subscribe, and let's look at some cases. This is an X-ray of a young boy who presented with abdominal pain after potentially swallowing an object. If you look in the left middle abdomen, you'll see what looks like a pill-shaped density. And this density ended up being a swallowed marble. Ingested foreign bodies are very common, and most are passable without intervention. However, X-rays are only good at identifying radiopaque foreign objects. There are many non-radiopaque objects such as fish and chicken bones, wood, plastic, and thin objects which can be easily missed on an X-ray. Here is a rare radiographic example of an amorphous density seen scattered throughout the lower hemipelvis and around the hips. On the lateral view, we can see that this density is located within the soft tissues posterior to the sacrum and pelvis. So any ideas at what this density represents? This radiographic finding is due to dermal filler injections. So the injection of dermal fillers is used to achieve a desirable cosmetic outcome, and there's all different types of biologic and synthetic substances which are used. And there can be minor and major complications that can arise, like granuloma formation or visibility of these densities on X-rays. This is a really unique case of a woman presenting with severe abdominal pain, and you can see a large area of air which represents a large bowel obstruction, and then inferior to that is a large dense area which represents everything else in the abdomen being pushed inferiorly. On the lateral view, you'll notice a huge amount of air, almost resembling a lateral chest film. This large volume of air is a cecal volvulus, or an obstruction. So you can actually see the lung is all the way in the top corner. The liver shadow is being pushed posteriorly, and then all of the abdominal contents are being pushed down by this large bowel obstruction, pushing everything out of the way. This type of bowel obstruction is an immediate medical emergency. Here's a classic radiographic example of chronic infection in the ankle. This individual has a long-standing infection, which has led to chronic osteomyelitis, which is an inflammatory infection resulting in bone destruction and sequestration formation. Bacteria and fungi are the most common causes for osteomyelitis. Radiographically, we're looking for destruction of bone, periosteal reaction, and things like sequestration, involucrum, or cloaca. Here's a frontal view of the chest that demonstrates a large area of gas within the left middle lung field. The dense area represents the normal lung tissue, and the large radiolucent area represents a giant bulla, which is large, destroyed, and dilated airspace that occupies at least 1/3 the volume of the hemithorax. So this is a condition called vanishing lung syndrome, which is associated with several different forms of emphysema. So let's take a look at some interesting surgical cases. Here's an example of an orthopedic fixation screw stabilizing a previous C2 fracture. These are replacement intervertebral discs in the cervical spine. This is an example of anterior cervical discectomy and fusion of C3 through C7. Here is posterior cervical fusion with pedicle screw fixation. This is the combination of anterior cervical discectomy and fusion as well as posterior cervical fusion. This is an example of bilateral Harrington rod surgery used to correct severe scoliosis. And here's what that fusion looks like from the side. Here's an example of posterior lumbar interbody fusion stabilizing an L2 compression fracture. Here are three different surgeries: posterior lumbar interbody fusion at L2-3, replacement intervertebral disc at L4-5, and anterior lumbar interbody fusion at L5-S1. Here's the combination of posterior lumbar interbody fusion and anterior lumbar interbody fusion with a replacement intervertebral disc. And here's a surgical procedure called a lumbar corpectomy, usually following a removal of a spinal cord tumor. Here's a radiographic example of a rare spinal tumor. You should notice something different about the vertebral body shape of L4. And what we see is a slightly expansile, soap bubbly lytic lesion within the L4 vertebral body with thin cortices and no obvious evidence of an adjacent sclerotic reaction. And this is characteristic of a plasmacytoma, again a rare spinal tumor. Let's look at a few radiographic examples of amputation. Amputation refers to disconnection of all or part of a limb from the body. The term amputation is removal through the bone, versus a disarticulation, which is removal through the joint. Trauma and surgery are the most common causes. Peripheral artery disease can cause a lack of blood flow to the extremities and is one of the most common causes for amputation of the distal extremities. Complications of diabetes and non-healing infected foot and toe ulcers can also lead to amputation. Other less likely causes include frostbite and gangrene. Other reasons for surgical removal include severe traumatic injuries such as crushing and burn injuries. So these images are digital motion x-rays looking at lateral flexion and extension of the cervical spine. And vertebral instability is known as greater than 3.5 millimeters of translational hypermobility with flexion and extension. So that's what we're looking for with this type of motion study. Here's what looks like black lightning on the upper portion of this image, and this represents static electricity. And this type of artifact, which can be seen with plain film radiography, not with digital, does look like black lightning when static electricity is involved in the processing of the images. Here are a few examples of clothing artifacts on X-ray. And thanks for making it this far. If you enjoyed this video, please don't forget to like and subscribe. And any questions or comments, please put them below. Thanks again.